Hello viewers, I am Dr. Rabiul. I work as a lecturer of pathology in a medical college hospital and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is on autoimmune disease. In this lecture, we will learn about introduction and definition of autoimmune disease, the factors associated with its development. We will also talk briefly about its general mechanisms and general features, its classification, and towards the end of today's lecture, we will also talk briefly about some common autoimmune disease. Okay, a lot of topics, so let's begin. First question, what do we mean by autoimmune disease? Now, in order to understand this term, first in the introduction, I will talk about some various terms because my students often get confused with what do we mean by autoimmunity and what do we mean by autoimmune disease. So first, let's clarify these two terms. In the first slide, let's clarify what do we mean by the term autoimmunity and what do we mean by the term autoimmune disease. Regarding autoimmunity, always remember it is defined as presence of immune responses against self-tissue. Now, this term is just referring to the presence of autoantibodies or to the presence of autoreactive T lymphocytes. So whenever there is presence of autoantibodies or presence of autoreactive T lymphocytes, we can use this term autoimmunity, but it is not telling us whether there was tissue injury or organ damage due to the presence of these autoantibodies or self-reactive T lymphocytes. In other words, we can say that autoimmunity may also be a harmless phenomenon or it can be a tissue or organ damaging phenomenon as well. However, when these responses are causing significant tissue or organ damage, we are using a more specific term, and that is autoimmune disease. So to summarize, we can say that autoimmunity is a broader term. Whenever there is presence of autoantibodies or presence of autoreactive T cells, we can use this term. And whenever there is tissue or organ damage that is arising from these autoimmune events, we will use a more specific term, that is autoimmune disease. So, how can we define autoimmune disease? It is tissue injury that is caused by immunologic reaction against host's own tissues. In the next slide, let's clarify what do we mean by physiological autoimmunity and what do we mean by pathological or pathologic autoimmunity. So always remember, the mere presence of autoantibodies does not indicate the presence of an autoimmune disease. Autoantibodies can be found in the serum of apparently normal individuals, particularly in elderly persons. Again, harmless autoantibodies are sometimes produced after damage to tissues, and there these autoantibodies may have role in removal of tissue breakdown products. So these are examples of physiological autoimmunity. And what do we mean by pathological autoimmunity, or how can we define pathologic autoimmunity? Always remember at least 3 requirements should be met before we can consider autoimmunity as pathologic autoimmunity, that is causing autoimmune disease. So what are those requirements? Number 1, presence of an immune reaction that is specific for some self-antigen or self-tissue. Number 2, such a reaction should not be secondary to tissue damage and it should be of primary pathogenic significance. And the third point is there should be absence of other well-defined causes of the disease. When all these 3 requirements are met, then we can say that this particular autoimmunity is pathologic autoimmunity and it is causing autoimmune disease. Now, before moving on, I would also like to clarify 2 more terms, autoinflammatory and autoimmune. These 2 terms, although often used interchangeably, but these 2 terms are not the same. Autoinflammatory diseases can occur without autoimmunity. One example of such phenomenon is known as periodic fever syndrome. Again, autoimmune disease does not need to be inflammatory all the time. For example, immune thrombocytopenia, hemolytic anemia, myasthenia gravis. These are some autoimmune diseases where there is no inflammatory component. So now that we have defined autoimmune disease, now let's move on and talk about the factors that are associated with its development. In this slide, we will talk about factors that are responsible for autoimmune disease. They will include genetic factor, environmental factors, and hormonal factors. So let's talk about these various factors one by one. Regarding genetic factors, always remember most of the autoimmune diseases are in fact complex multigenic disorder. There is greater incidence of autoimmune disease in twins of affected individuals, and the incidence is also greater in monozygotic twins compared to dizygotic twins. And these findings indicate that there is strong genetic predisposition of autoimmune disease. There is association of some human leukocyte antigen alleles or HLA alleles with development of certain autoimmune diseases. Again, some non-MHC genes are also associated with development of certain autoimmune diseases, as we will see. So in this table, we can see some autoimmune diseases that are associated with certain HLA alleles. For example, rheumatoid arthritis is associated with DR4, ankylosing spondylitis is associated with HLA allele B27. Similarly, type 1 diabetes is associated with DR3, DR4, DQB1, etc. Systemic lupus erythematosus with DR3, DR8, DR15. Celiac disease is associated with HLA allele DQ2, DQ8, and multiple sclerosis is associated with DR15. Now this table is very important, particularly for your multiple choice type of question, so always remember this chart. Now regarding HLA alleles, I would also like to mention two more points. The first is always remember class 2 MHC related diseases occur more commonly in women. For example, rheumatoid arthritis, Graves' disease, systemic lupus erythematosus. These occur more commonly in women, and these are class 2 MHC related diseases. And class 1 MHC related diseases occur more commonly in men. Example will include ankylosing spondylitis and reactive arthritis. This slide is showing association of non-MHC genes with certain autoimmune diseases. For example, the gene PTPN22 is associated with rheumatoid arthritis and type 1 diabetes. NOD2 gene is associated with Crohn's disease, and interleukin-2 receptor and interleukin-7 receptor alpha gene is associated with multiple sclerosis. In this slide, we will talk about the environmental factors that are associated with autoimmune diseases. So there is important role of infections, and always remember infections can have two roles. Certain autoimmune diseases may be triggered by some infections. Again, some infections may be protective against some autoimmune diseases. So first, let's talk about autoimmune diseases that are triggered by some infections. What is the mechanism? Infections may upregulate the expression of co-stimulators on antigen-presenting cells, and this is one of the mechanisms by which that may lead to development of autoimmune disease. The second mechanism is molecular mimicry. Here, the environmental trigger resembles a component of our body sufficiently, so whenever there is an immune response or immune attack against that environmental trigger, that is also directed against the cross-reacting body component. Another mechanism is that some viruses can cause polyclonal B-cell activation, for example, regarding Epstein-Barr virus infection and also in HIV infection. Again, tissue injury that is frequent in infections may release self-antigens and also structurally alter these antigens, and all these things may also lead to development of autoimmune disease. This slide is showing some examples of infections that are associated with certain autoimmune diseases. For example, Streptococcus pyogenes is associated with rheumatic fever. Campylobacter jejuni is associated with Guillain-Barré syndrome. Chlamydia trachomatis and Shigella species are associated with reactive arthritis. E. coli is associated with primary biliary cirrhosis. Regarding viruses, we can see that hepatitis B virus is associated with multiple sclerosis, hepatitis C virus is associated with mixed cryoglobulinemia, and so on. Now, recall that I had said some infections may protect against some autoimmune diseases. Now, let's talk about that. Incidence of autoimmune disease is increasing in developed countries since infections are better controlled. In some animal models, infections greatly reduce the incidence of disease, for example, of type 1 diabetes. Infections promote low-level interleukin-2 production, and this is essential for maintaining regulatory T cells. So whenever there is infection, that can promote low-level interleukin-2 production, and that is important and essential for maintaining regulatory T cells. And as we know, regulatory T cells will suppress autoimmune disease. So that is how some infections may protect against certain autoimmune diseases. Regarding hormonal factors, 90% of all autoimmune diseases occur in women. Some evidence from animal models suggest that estrogen can alter the B cell repertoire and enhance the formation of antibody against DNA. For example, systemic lupus erythematosus either appears or exacerbates during pregnancy or immediately postpartum. So now that we have talked about the factors associated with development of autoimmune disease, now let's move on and talk about the general mechanisms of autoimmune disease. This slide is showing the general mechanisms of autoimmune diseases. As we can see, several mechanisms are involved. They will include molecular mimicry, alteration of normal protein, release of sequestered antigens, epitope spreading, failure of regulatory T cells, etc. What do we mean by molecular mimicry? Here, environmental trigger is resembling or mimicking a component of our body sufficiently. So what is happening as a result of this resemblance? When an immune attack is directed against those environmental trigger, they are also attacking the cross-reacting body component. So as written in the slide, we can see here an immune attack is also directed against the cross-reacting body component. One of the best examples of molecular mimicry is the relationship between the M protein of Streptococcus pyogenes and myosin of cardiac muscle. So when there is infection with Streptococcus pyogenes, antibodies are formed against the M protein, but since this M protein resembles or mimics myosin of the cardiac muscle, so the antibodies also attack the myosin of our cardiac muscle, and that leads to heart damage that we see in rheumatic heart disease. Another example of molecular mimicry is reactive arthritis that occurs after infection with Shigella or chlamydia, and another example is Guillain-Barré syndrome occurring after infection with Campylobacter. What do we mean by alteration of normal protein? Always remember, some drugs can bind with normal proteins and make them immunogenic. And when they become immunogenic, our body's immune system may induce or initiate an immune response against those proteins. Example of such alteration of normal protein is procainamide-induced systemic lupus erythematosus. The next mechanism is release of sequestered antigen. Now, whenever you mention release of sequestered antigen, the examiners are very fond of asking you, what do you mean by immunologically privileged sites? Because whenever there is damage to immunologically privileged sites, that is the time when these sequestered antigens are released and these antigens become exposed to our immune system. So always remember, certain tissues are sequestered in such a way that their antigen are less exposed to our immune system. What are those organs? Examples will include the testes, central nervous system, lens and uveal tract of the eye. So these tissues are less exposed to our immune system. So whenever there is damage to these organs, or due to some other reason, these antigens enter the circulation accidentally, they can induce immune response because our immune system had little exposure to these tissues, so it will think of these tissues as foreign invaders. So what will happen whenever there is exposure of certain tissues from the testis to our immune system, that may lead to aspermatogenesis. If central nervous system tissues become exposed to our immune system, that may lead to encephalitis. Whenever tissues from the lens and uveal tract of the eye are exposed to our immune system, that may lead to endophthalmitis. Now always remember, intracellular antigens like DNA, histone, and mitochondrial enzymes are also normally sequestered from our immune system. So whenever there is cellular damage from bacterial or viral infection, radiation, and chemicals, these may cause the release of these sequestered antigens and induce immune response. The next mechanism is epitope spreading. You may also have questions in your written exam in the form of short notes from this topic, like what do you mean by epitope spreading? So always remember, it is the new exposure of sequestered autoantigens as a result of damage to cells caused by viral infection. These newly exposed autoantigens will stimulate autoreactive T cells, and that will cause autoimmune disease. Now, the last line is very interesting. These self-reactive T cells are directed against cellular autoantigen rather than the antigen of the virus, and that's why they are resulting in development of autoimmune disease. The next mechanism is failure of regulatory T cells. Whenever there is mutation in the genes encoding AIRE or in the genes encoding FOXP that is required for regulatory T cell differentiation, there will be deficiency of regulatory T cells, and ultimately that will lead to autoimmunity. Mutations in genes encoding proteins involved in T cell receptor signaling can lead to both immunodeficiency and autoimmunity because there is complex effect on thymic selection. So now that we have talked about the general mechanisms, now let's move on and talk about the general features of autoimmune disease. This slide is showing the general features of autoimmune diseases. These diseases tend to be chronic, sometimes with relapses and remissions. Tissue damage is often progressive, and the clinical and pathological features are determined by the nature of the underlying immune response. So now that we have talked about the general features of autoimmune disease, now let's move on and talk about its classification. So how can we classify autoimmune disease? We can classify them under two broad headings. They are organ-specific autoimmune diseases and systemic autoimmune diseases. So what are some examples of organ-specific autoimmune diseases? They will include autoimmune hemolytic anemia, immune thrombocytopenic purpura, which is also known as ITP, atrophic gastritis that we see in pernicious anemia, multiple sclerosis, insulin-dependent, as well as insulin-resistant diabetes mellitus, myasthenia gravis, Graves' disease, Hashimoto thyroiditis, Guillain-Barré syndrome, celiac disease, inflammatory bowel disease that will include Crohn's disease and ulcerative colitis, immunoglobulin A nephropathy, psoriasis, etc. And what are the systemic autoimmune diseases? Examples will include systemic lupus erythematosus, rheumatoid arthritis, reactive arthritis, vasculitis, Gout-Pasteur's syndrome, etc. So from this classification we can see that there are a lot of autoimmune diseases and it is impossible to cover them in details in one lecture. So in this lecture we will just give an overview of these various autoimmune diseases. So now let's talk briefly about these autoimmune diseases, and first we will start with talking briefly about the organ-specific autoimmune diseases. What is happening in autoimmune hemolytic anemia? Here there is formation of autoantibodies against the red blood cell surface antigens, and when these autoantibodies are attaching with their red blood cell surface antigens, that will lead to subsequent cellular destruction. So what is happening in immune thrombocytopenic purpura? Here there is attachment of autoantibodies to the platelets, and then those platelets are either destroyed in the spleen or lysed by membrane attack complex. What is happening in atrophic gastritis? It is caused by antibodies to intrinsic factor, and always remember, intrinsic factor is a protein that is secreted by parietal cells of the stomach, and it helps in absorption of vitamin B12. In multiple sclerosis, autoreactive T cells and activated macrophages will cause demyelination of the white matter of the brain, and always remember it will affect both sensory and motor functions. In insulin-dependent diabetes mellitus, autoreactive T cells will destroy insulin-producing islet cells of the pancreas. Autoantibodies targeting islet cell antigens, including insulin, may also have a role. In insulin-resistant diabetes mellitus, there is formation of antibodies against insulin receptors, and these antibodies will interfere with binding of insulin with the insulin receptor. In myasthenia gravis, there is formation of antibodies against acetylcholine receptors, and these antibodies will block neuromuscular junction signaling and cause severe muscle weakness. In Graves' disease, there is formation of circulating antibodies to thyrotropin receptors, and these antibodies in fact resemble thyrotropin in activity, and therefore when these antibodies are binding with thyrotropin receptor, they will act just like thyrotropin and they will stimulate thyroid to produce more thyroxine hormone. In Hashimoto thyroiditis, antibodies are formed against thyroglobulin and thyroid peroxidase, and they will provoke an inflammatory process, and that will also lead to fibrosis of the glands as well. In Guillain-Barré syndrome, antibodies are formed against membrane gangliosides. Complement will be activated. Ultimately, membrane attack complex will be formed, and that will destroy the myelin sheath, leading to demyelinating polyneuropathy. In celiac disease, there is destruction of enterocytes leading to villus atrophy, inflammation, and malabsorption. All these things are primarily caused by cytotoxic T cells that react to protein antigen gliadin. Most patients also have antibodies to tissue transglutaminase as well. In inflammatory bowel disease, there is abnormal immune response to certain members of the normal intestinal flora. In immunoglobulin A nephropathy, there is formation of immune complexes that contain immunoglobulin A, and these immune complexes will line the glomeruli. So as you can see, the glomeruli are lined with immune complexes containing immunoglobulin A in IgA nephropathy. In psoriasis, there is chronic autoimmune skin disease, and always remember that it is characterized by raised erythematous plaques and silvery scales. Regarding systemic autoimmune disease, what is happening in systemic lupus erythematosus? There is chronic inflammatory autoimmune disease affecting skin of the face, joints, and the kidneys. Antibodies are formed against DNA and other nuclear components of the cells. In rheumatoid arthritis, always remember it involves the joints and also certain other organs like the lung and pericardium. Immune complexes are deposited. They are composed of normal immunoglobulin G and rheumatoid factor, and these immune complexes are deposited on synovial membrane of the joint and also in blood vessels. There will be complement activation, and that will attract polymorphonuclear cells, and all these things will lead to inflammation. In reactive arthritis, there is acute inflammation of the joints, and it usually occurs 1 to 3 weeks after various bacterial infections. It is associated with enteric infections by Shigella campylobacter, Salmonella, Yersinia, and also with urethritis caused by Chlamydia trachomatis. And always remember, it is caused either by cross-reactive immune responses to self-antigens or by immune complexes with foreign antigen that deposit in joints. Regarding vasculitis, always remember certain autoimmune diseases manifest with vasculitis, and it is usually caused by deposition of immune complex in the blood vessel. Examples will include polyarteritis nodosa, Henoch-Schönlein purpura, which is also known as immunoglobulin A vasculitis, vasculitis that occurs in SLE, and cryoglobulin-related vasculitis. In Goodpasture syndrome, autoantibodies are formed against collagen in the basement membrane of the kidneys and lungs. So this concludes our lecture on autoimmune diseases. I hope this video was helpful. If you like my videos, do comment, share, subscribe, and let me know. And for my students, I will also recommend you to go through your textbooks to know more. Okay, that's all for today. Until next time, Take care and stay safe. Thank you.